Hello guys, today we talk about the inhalational anesthetic agents. Inhalational anesthetic agent reach the target organ, that is the central nervous system, by this manner. First the anesthetic agent go to the machine, then circuit, then airway, then reach to the alveoli, thereafter blood, then at last reach to the central nervous system. Since it has to cover such a long distance, we need a driving gas, that is the carrier gas. Here we note that the 100% oxygen should not be used as a carrier gas because oxygen in high concentration causes toxicity, uh, free radical damage. Therefore, oxygen plus nitrous oxide N2O should be given. Okay, now we talk about the N2O property. N2O is having inhalational anesthetic agent, but not potent enough to used as a sole anesthetic agent. Okay friends, so N2O is primarily a carrier gas. Okay, carrier gas means it is mainly used for the carrier purpose. It also help main anesthetic agent to carry out the different component of the general anesthesia. Okay, here one thing we have to note, in case of N2O we can use air also, but since air is not an anesthetic agent, it will not provide additional benefit which is provided by the N2O. Okay friends, but in some cases where the N2O is contraindicated, in that cases we can use air as an carrier gases. Okay, we have to remember this. Now we talk about the inhalational anesthetic agents. So inhalational anesthetic agents are divided into two groups, potent inhalational anesthetic agent and carrier gases. So potent anesthetic agents are again divided into the new agents and old agents. So the new agents are halothane, isoflurane, sevoflurane, desoflurane, methoxyflurane and fluorine. And the old agent which are mainly ether, chloroform, cyclopropane and trilene. Here the newer agent halothane, isoflurane, sevoflurane and desoflurane used in the current level of practice. The carrier gases are N2O and xenon. Okay friends, now we talk about the nomenclature used with inhalational anesthetic agents. There are two main groups, MAC, which stands for the minimum alveolar concentration, and the second is the blood gas partition coefficient. This is also known as a blood gas solubility and again also known as the diffuse coefficient. Now we talk about the minimum alveolar concentration. So friends, it is the minimum alveolar concentration of inhalational anesthetic agent required to produce no movement on surgical stimulation in 50% of the test population. So whenever we say MAC, it always means MAC 50%. So we have to remember this. Okay, now again the term MAC 95 is used sometimes. It is the 1.3 to 1.5 times of the MAC 50%. Now MAC awake, which stands for the patient start regaining his consciousness, and again the sub-maximal MAC, which produces a sympathetic stimulation. So let's talk about the potency of such drugs. So the highest potency is having halothane, then isoflurane, then sevoflurane, then desoflurane. So let's talk about the minimum alveolar concentration of this drug. Here are these shown the minimum alveolar concentration of these drugs. So we have to remember less minimum alveolar concentration is equal to high potency and high MAC is equal to low potency. Now let's just discuss the question. Most potent inhalational agent is methoxyflurane and the least potent inhalational agent is NO2, which having the minimum alveolar concentration of 104. Now we have to note the Myers-Overston's rule, which states that the potency of the inhalational anesthetic agents is directly proportional to its lipid solubility. We have to remember this. Now we talk about the conditions when the minimum alveolar concentration decreases and increases. So first decreases in the cases of the hypoxia, hypercapnia, hyperthermia, hypercalcemia, hypovolemia and hyponatremia. And one factor, as age increases, the minimum alveolar concentration decreases by 6% per decade. Second is the pregnancy, acute alcohol intoxication, any drug contributing in any component of the general anesthesia. chronic amphetamine and other substance abuse. Now let's discuss some of the cases which increases the minimum alveolar concentration. So the cases are seizure. If temperature is greater than 42 degrees Celsius, it causes the CNS excitation. Now the hypernatremia, an infant having the maximum minimum alveolar concentration. Then the chronic alcoholism, acute amphetamine and other substance abuse. Okay friends, now let's talk about the second component, blood gas partition coefficient. Blood gas, it is noted that the CNS concentration of the inhalational agent is directly proportional to the alveolar concentration. Now, high blood gas solubility, which means more soluble in blood, and which drug is more soluble in blood causes alveolar concentration decreases very fast, then it takes more times to achieve the CNS concentration. Okay friends, thus high blood gas solubility means a slow speed of induction, and low blood gas solubility, which means high speed of induction. Now blood gas solubility is maximum in halothane and decreases further, and the speed of induction is maximum in desflurane and lowest in halothane. Now we talk about the induction of the general anesthesia. Desflurane is a very pungent smelling, so can't used as induction of anesthesia. Sevoflurane is a sweet smelling. It is the inhalational agent of choice, and sevoflurane is the most appropriate inhalational agent in pediatrics also. So at last, the sevoflurane is the induction of choice in any case of anesthesia. Now we talk about the maintenance of the general anesthesia. In case low blood gas solubility, which causes the fast recovery. Okay. Then the talk about the sevoflurane and desflurane. So sevoflurane and desflurane having the good for maintenance of general anesthesia, very appropriate for day care surgeries, and has shown these both drugs shown the incidence of the past operative delirium and hallucination, especially in the pediatric age groups. Okay friends, we have to remember this. Now I'll talk about the pharmacokinetics of the inhalational anesthetic agents. So let's talk first about the chemistry of these drugs. So the halothane are halogenated ethane, and the rest of the three are halogenated ethers. So let's discuss the chemical structure. The chemical structure of isoflurane are shown in the figure, and here we have to remember the N-fluorine and isoflurane are just isomers. Okay, the structure is shown, and desflurane has the maximum highest fluorine content, so it is the most stable component of all the inhalational anesthetic agents. Now talk about the boiling point. So the boiling point is 50 plus minus 2 degrees Celsius of these three drugs, halothane, isoflurane and sevoflurane. But the desflurane is boils at the room temperature, so therefore it is stored in TEC compound. Color is red, purple, yellow, blue. Minimum alveolar concentration, as we discussed earlier in this video, and it is noted that the minimum alveolar concentration increases, so the potency decreases. Blood gas solubility are as follows of these drugs. Just see the video, and we have to remember that the fast induction and the fast recovery for isoflurane and desflurane. Stability, isoflurane and sevoflurane are quite stable. Desflurane is the most stable, but halothane is the most unstable gas, so it can be stored in thymol 0.1% preservative. Metabolism, the halothane is greater than 30% is metabolized, and the desflurane is not metabolized. Okay. Uses, the halothane is good smell, so used for both induction and maintenance, while the isoflurane is used for only maintenance. Sevoflurane is the induction of choice agent, and the desflurane, due to its stability, it is used for the maintenance of the general anesthesia. If you like the content of this video, please like, subscribe, share with your friends, and press the bell icon for the further updates. Comment below on what topic you want the next video. Thank you.